Okay, looks like we have a lot of people here, so we can go ahead and get started. Guneshish, thank you all for coming. Today we're going to be talking about the Indigenous Connectedness Framework, a framework created by Dr. Jessica Saniguq Ullrich with the knowledge and input of 25 Alaska Native child welfare knowledge bearers. And before we get into, talking about this webinar, I'd like to just first go over, our Zoom capabilities and our Zoom atmosphere right now, and also myself. So my name is Malia Wenzel. I am the Community Resilience Fellow with the Alaska Children's Trust and the Alaska Resilience Initiative. And today I'm sort of your Zoom webinar DJ. So I will be the one helping facilitate all of our wonderful information today. And I'll be the one that you can reach out to about Zoom related questions. So first off, right now we are in Zoom webinar. That means that we cannot see or hear any of the participants. So if you're joining us for our webinar today, don't worry, we cannot see or hear you. As well, this webinar is being recorded and we will send it out at the end of the day. If you have any questions throughout the webinar, you can go ahead and send that through the Q&A function. We will be answering questions at the end. And so any questions that you send us along the way, we'll try to answer at the end. And if there's any question that you would like to, speak yourself and not just have me read, when we get to the question section, you can just go ahead and raise your hand using the little raise hand function that's at the bottom of the Zoom page, and I will unmute you. And when I unmute you, you will have the opportunity to speak. If you have any tech related questions, if you don't really understand how the Zoom works, or if something seems off, or if it seems like someone's breaking up a little bit, you can go ahead and send those through the chat function, and I will do my best to help with the issue that comes on at the time. And as well, Dr. Ullrich has, wonderfully offered to send us her slides. And so at the end of the webinar, when we send out the recording, we will also send the slides. And let's get into the webinar. Dr. Jessica Saniguq Ullrich is an assistant professor at the University of Alaska, Anchorage. Sorry about this, just a second, my notes are all over the place. She is also a tribal member of the Nome Eskimo community, and she is the proud mother of 2 middle school age children. Dr. Ullrich has done research in Indigenous well-being, spirituality, environmental connectedness, protective factors, child abuse prevention, suicide prevention, substance abuse prevention, domestic violence prevention, and language revitalization. Today, Dr. Ullrich will be talking to us about her Indigenous Connectedness Framework. This framework can be used to inform communities, family members, and advocates on the shifts that can be made to acknowledge trauma and disconnect, the ways that we can relationally heal, and how getting back to teaching children and youth who they are and where they come from, as our elders have instructed us for generations, can help us to be collectively healthy and well. This framework is malleable and it can be adapted to many communities across Alaska and outside of Alaska as well. The Indigenous Connectedness Framework was informed by the experiences and insights of 25 Alaska Native child welfare knowledge bearers. And from here on out, I'll let you take it over, Dr. Ullrich.
All right, thank you. So let me get my screen up here.
All
right. So good morning, Uvalalotak, Uvanga Jessica Saniguq Ullrich, as Malia stated, and I am so grateful to speak with you all today about some research that I've been a part of in terms of the development of this Indigenous Connectedness Framework. And I would sort of reframe it a little bit in terms of I don't feel like this is my framework. It's something that I feel like I was sort of piecing bits of the puzzle together, but this is something that we have some commonalities across tribal communities, and this is our framework. And it's not that I'm presenting like brand new knowledge. I think it's really a representation of it. it's helping us reconnect with our traditional knowledges and wisdom that have sustained us for generations. And so I'll be sharing with you a little bit about my journey to the development of this framework, looking at child well-being models out there that was embedded in Indigenous research literature. And then, as Malia stated, I'll present to you what I was learning from the knowledge bearers that I spoke with that gave me more in-depth insights into this framework and how to think about it. So I do want to start off, and I've given this presentation many times this year, and I don't know if any of you have heard this presentation before, but I always like to start off with this slide where I express my gratitude to this beautiful earth, to the lands that I'm upon that belong to the Dena'ina people. I'm based out of Anchorage. But my family's originally from Wales, Alaska, and this is a picture of my great-grandmother, my grandmother, my mom, my little sister, and then this is me when I was around age 6 years old. And so I draw strength from my family lineage, and every time that I talk about this subject, I think about what my family's been through, and I think about what other families have been through, and it's my prayer to do this work in a good way, that it's something that is beneficial, it's helpful, and it's going to lead to better outcomes for children. And that was also that sort of setting an intention for this presentation is, I feel like, part of the process, that every time we do research, every time you're connecting with someone else, no matter what role you have, setting that intention to do good and to promote well-being it's something that can connect us in a powerful way. So I express gratitude to this earth, the air that we breathe, the water that we drink, the food that we eat, the warmth that we have that sustains us. I'm grateful for our collective ancestors, and I feel connected to our future generations. I am so grateful for all of you. I see you as, my community, and I'm grateful for the storytellers out there, the people that are doing the good work to promote positive change. And I'm especially grateful to our sacred children. And as one of my papers is titled, it's really, this work for me has been about for the love of our children. I love children. I believe that they come with so many gifts. They're our teachers in many ways. And I feel like if we can figure out a way to keep our children healthy and strong and connected to who they are and where they come from, that we'll have a healthy society and a healthy community and healthy families. So that's part of where I come from. And I love this, this quote that I saw on social media about a year ago. And this is, again, kind of connected to that intention of why I want to engage in this research and in this work that I've been a part of for a number of years now. And it's really about this, that, this hope that we raise our babies with our Indigenous love rather than with our colonial pain. So I do just want to let you know there's this paper out there. I can share this with Malia as well to distribute if that might be helpful. But part of what started this journey and this process was doing a literature review. And that literature review involved looking at articles, books, and literature that was really focusing on Indigenous well-being. There weren't very many research articles that I found that were specific to Indigenous child well-being. I think there was primarily one that focused on that out of Australia, but a lot of the literature focused on this broader well-being for Indigenous peoples. So I'm just going to share with you, a couple examples of those models, and this is one of them from Oscar Coagley out of the Yupiaq Worldview book that he wrote. And this is the article that focused on Indigenous child well-being out of Australia. So I was looking at these models and I was reading these papers and books and things and trying to look for what are those key relationships or concepts or mechanisms that is sort of embedded in these articles that highlight how to promote child well-being. And this was another model out of Hawaii. And this is one that I found in an Alaska Native focused paper. So I was just looking across all of these and doing a little bit of analysis. And this was the first rough draft of the Indigenous Connectedness Framework based on what I was reading and seeing. And part of what I was kind of drawing from the literature was the importance of connectedness to land, to community, to the ancestors and future generations, to family, and the backdrop of like this all-encompassing connection to God or creator, the universe, and that these relationships could promote spiritual connectedness within a child, and that these relationships were supported through some of these different mechanisms like activities, actions that build and develop and strengthen relationships. And that when a child is well, and they have that connection and all of these relationships in their life, that it can help them sort of understand that they're connected to a collective. So this was the first draft version. I outlined in that paper kind of this table that highlights some of those mechanisms again, like the ways that those relationships were maintained or developed or strengthened. And I'll just point out real quick, because the language was kind of across the board a key element to forming some of these important relationships in multiple ways. And when you think about language, it connects a family, it can connect a person to their community, it can connect a person to the land, it can connect us to our ancestors especially, and then also to spirit in terms of language being used in ceremonies and all of these different activities, storytelling through songs and dance. When it's in our language, it's part of the way that it helps us connect to our spirit and spirituality. So that was one important thing. And in terms of this framework, I also want to point out that it's also it's a framework. So it's meant to be filled in with community-specific knowledge, community-specific histories, and stories and cultural ways of viewing things. This is a picture of from Wales back in the early 1900s, and that's going to look totally different than a community in Southeast, for example. So it's really important that this framework, when people are looking at how can we use this, is to look at adapting it to be specific to your community, because I think that in that way it could be more useful and effective. So this framework just provides kind of that broader level view of the common concepts and ways to build a relationship. So now switching gears to talk about the dissertation research. These were my primary aims going into it. I wanted to talk to Alaska Native foster care alumni, relative caregivers, and foster parents about what they thought were important ways of promoting child well-being and how they conceptualize child well-being and what those key relationships were again. So I was sort of taking that initial framework and comparing it to what people shared with me in terms of their thoughts and ideas and feelings about it. And I was also, part of why I was doing it within the child welfare context is because I also have a child welfare background. I worked for OCS for 8.5 years before going back to school and deciding to get a PhD to do more research. But it's also because around the time that it was this proposal was being put together, the Indian Child Welfare Act was found to be unconstitutional in a federal court. And as I read that judge's response and decision on that matter, it really stood out to me, something that he said, where I was like, I don't think that people really truly understand why Indigenous communities and people and families, why these relationships to the community and to extended family members and to, to culture and those sorts of things, why it's so important. So I was hoping to ask people within the child welfare system, specifically kind of around the ICWA preference placements, to also shed light on that. So that was sort of like a latent question. And that's what number 2 sort of getting at, is like, how did Alaska Native relative or foster parent placements, how did that promote well-being as well? So I had community partners. I worked with FFCA and the Alaska Center for Resource Families to help me with the development of the questions that I was going to ask the people I spoke with. They helped me figure out what kind of gift card, like honorarium, I could provide. They helped me with thinking about the results. And most importantly, they helped me with help recruiting knowledge bearers to participate in this study. So like they've been with me every step of the way. And anytime that I receive like an honorarium for presenting on this research, I'm giving back to these organizations, because I understand the importance of that reciprocity. And I'm hoping that this research can benefit the people that they're directly serving. So this is a list of some of my key advisors. I had a community advisory board, so to speak, on this side. And then I also had my supervisory committee that gave me so much guidance throughout the process. And in terms of the people that I spoke with, they're from all over the state. I did some interviews in person and some of them through like a video platform like Zoom, or I think I FaceTimed with someone. It depended on what their preference was, but I wanted to be able to see them so I could at least sort of read the body language as we talked. And that way we could still connect in that way. But the only region I didn't get a hold of someone from was the Aleutian area, but I spoke with at least one person from all these other areas. And I have it this way to protect people's identities. And when I share some quotes from the knowledge bearers in just a little bit, they selected their own alternative names so that they could, if they reviewed the research and the dissertation, they knew like what their contribution was embedded in the written up publication. These were the methods that I used. I relied on Indigenous methodologies that take into consideration power and ethics and community and relationality and storytelling. And then I also engaged in some qualitative methods, more specifically around that content analysis, helping me do some coding of the transcripts. And then I engaged in Indigenous storying or story work, which is an emerging method, to make sense of that bigger picture view of what are the lessons to be learned from all this. So I engaged in 4 main cycles of analysis to help me get at some results. And this is just a graph of some of the coding that I did after I came up with all these codes, and I merged codes back together into these. I believe I came up with 10 total. 7, 8, 9. I got 9 listed here. This was the number of times that I applied that code to all of the knowledge bearers transcripts. So it just gives some indication of how frequently people spoke about some of these areas in terms of how I was also viewing what they're saying. But they spoke the most about mechanisms of well-being, followed by trauma as a challenge, followed by family connectedness, cultural connectedness, and on down. And when I shared some of this initial data, preliminary data with community partners, they pointed out something interesting as well that I'm still thinking about, but said, isn't it a little bit telling that intergenerational connectedness, spiritual connectedness, and environmental connectedness were coded the least amount of times? And what's that about? But that, yeah, I was like, that's a good point. But now I would like to share a few quotes from the knowledge bearers that kind of hit on some of these concepts. So in terms of family connectedness, this is a foster care alumni saying how their relative placement just felt like home to this person, and that even though it wasn't their house that they grew up in, it was nice to have something familiar. They'd been to that place before. They were with someone they knew. And that relative helped them maintain a schedule and kind of stick to more of the routine that they were used to. And that was a way that family connectedness promoted well-being. And then in terms of community connectedness, this was a foster parent that talked about how, and the quote says, it takes a village to raise a child. It's being connected to that community and knowing that if there's an issue, that community will step in and help. So this person was saying, I think that when you hear the phrase, it takes a village to raise a child, it's easy to disassociate yourself from the responsibility of being able to connect. And kind of what that was highlighting for me, the aha light bulb moment, was realizing, it's not enough to see children and youth walking down the street and know that they live in your area. It's like, their name and they know your name, and you have that relationship and that connection, and to help them feel like their community is seeing them and that they belong, and that the community's there to support. And in terms of environmental connectedness, this was alumni who shared how there are often many times when he would feel sort of at a loss for having multiple placement moves, or start to wonder, am I to blame for the situation that I'm in? And part of how he coped and got through those challenging times was by getting out on the land. And he shares that just getting out there in the country, it helps free the mind and the soul, and how important that was, how huge it was for him. So that connection with the land and nature, I think especially, I don't know if it was a coping mechanism for some of you during these times of COVID that we're in, but that was a huge source of strength, I think, for many of us, and can relate to what Sarge is saying here. And this, another kind of important component that came out of the dissertation research was I grew to have a better understanding of how important it is for children to build and develop an internal connectedness, to have a relational identity, to know who they are and where they come from at the core. And this is an example of another alumni sharing a little bit about that and saying how the quote is, "The importance for me is to know where I came from and to know who I am and just being me, because in this world, without my culture and without my language and without the stuff I know, I feel lost. Who am I? Was I supposed to be someone different? And I should learn those things. And it's just really important to me to know that stuff so I can pass it down to my children, because it's who we are. And it's really important to have with us." So this piece was something that was a major component of the overall findings. I had a better understanding of that importance of knowing who you are as I listened to the knowledge bearers share their story. And these were the three main lessons that I was sort of drawing from all the knowledge bearers and what they shared. So one of the first lesson that I learned was how important it is that we acknowledge the trauma, children's trauma, some of the disconnectedness, the relationships that aren't as strong and maybe haven't formed yet, and some of the relational wounding that has happened through these different relationships that the child might have in their life. And then the second lesson was in regards to the importance of maintaining relational continuity. So if a child did become involved with child welfare, they need to still have connections to the land and to their community and to their family, not just their parents, but their whole family, to that knowledge of who their ancestors are, like the family history, and to people that can teach them about their culture and spirit. So that's the piece about connectedness being maintained. And then the third lesson was, again, kind of back to that internal connectedness, helping children know who they are, where they come from, helping them maintain that. And I'll speak a little bit more about that in a bit. But this was from all of that. This is an updated Indigenous Connectedness Framework. I just want to explain some of the components on here. So the lettering in red is representing the acknowledgement of the trauma. And these are all different traumas and challenges that people brought up in their interviews. And the hope is that by helping children develop and strengthen healthy relationships and connectedness relationships in their life can help prevent these traumas and challenges from becoming mechanisms of disconnect, from becoming a trauma identity, or from becoming a child's, like a child getting into survivor mode is sort of how I also think about it. Constantly kind of being in that fight, flight, freeze mode. So the red represents the challenges. The blue outer circle is representing those mechanisms of well-being. And I incorporated some of the lettering, the words in the red in that, because it's not to say that we get to escape from some of these challenges in our life. No one gets through life unscathed is sort of what I learned, that we all experience traumas, but the goal and the hope is to keep them from becoming who we are at the core. And I'll kind of, like I said, I'll explain that in just a bit. But this green inner circle is representing what happens internally when a child develops healthy relationships with others, and that they have the sense of safety and they feel like they belong. And those relationships are teaching them that they matter and that they have gifts and that they have ancestral strength, and they, learn to forgive and have self-worth and all of those things. That aspect of being in right relationship with yourself and others, it's this reciprocal process. after that. And it's like, when I'm in right relationship with myself, I'm more apt to be in right relationship with others. I'll know how to set the boundaries, and I'll know who to keep in my life and maybe who to create more distance from. But out of the relationships I do have, the connections I make are healthy and strong. But kind of back to the trauma piece and the challenges, a lot of what was shared touched on what I'm calling a relational wound that happened. So child maltreatment, for example, that creates a relational wound. If people are in violent relationships, that's a relational wound. If people are disconnected from their cultural knowledge and from their elders and from people that can teach them some pieces of like spirituality, for example, that can create a relational wound. So when there's been multiple cumulative compounding relational wounding traumas that have happened, it can sometimes create a little bit of an identity crisis. And this is what I share in my discussion section, because this wasn't the focus of my research, but it came up enough that I wanted to make sure I commented on it. But what we want to prevent is disconnectedness. So this, I feel like it's a very extreme example. I don't think that many people are completely disconnected in this way. But I think it, again, kind of this model is showing if multiple relational wounds have happened, and it becomes that mechanism of disconnect, and it can sort of create this identity that is not relational based, it's fear based, it's like trauma based, it's survivor based. And this is where I'm sort of putting a hypothesis out there that if people are struggling with violence or struggling with substances or seeing a lot of suicide and those sorts of challenges going on, that there's maybe quite a bit of disconnect going on. And perhaps and this is what I felt the knowledge bearers shed a lot of light on, is that how to heal from those relational wounds. And it was such an honor to hear the stories that I heard. It was very moving. I felt like it was healing for both of us to engage in that sort of storytelling ceremony. And that was some of the feedback I got from some of the knowledge bearers that shared this. But I feel like they had so much wisdom about how to do that relational healing piece, to come back in right relationship with themselves as well, to come sort of formulate that identity that trusts, that feels safe, that knows that they belong. And the way that that relational healing sort of happens, it can take place in a whole lot of different ways. So if I go back to this slide here, I had alumni talk about how awesome it was to go to culture camps and connect with other youth, and to be part of FFCA, for example, or some people, there's just a number of ways that they healed from relational wounds and disconnect. So that's where I feel like, in terms of implications, we as a community, as people, Indigenous people, we have the solutions to some of the challenges that we face, to the traumas that we've been through, that our ancestors or family members and community members have been through. And part of that healing process is connected to this cultural and spiritual element. A lot of the ways that what we call culture, naming ceremonies and potlatches and dance festivals and the clothing we wear. And just there's so many aspects to culture, the food, specifically the food that we eat, soul food, like it's connected to spirit. So I sort of view these terms interchangeably a little bit. But those are the key mechanisms for our well-being. So that's part of what we have and part of what we're revitalizing and bringing back. And that's where we have a lot of awesome things going on, connecting with elders, helping that knowledge be passed on to the next generations. And I love this quote by grandmother Rita Blumenstein. And I feel like it kind of highlights as well. I just see connectedness in everything now. So I'm pretty biased in that way, but I feel like this quote is also highlighting connectedness, and she says, "The past is not a burden. It is a scaffold which brought us to this day. We are free to be who we are, to create our own life out of our past and out of the present. We are our ancestors, our grandmothers, our grandfathers, and our children. When we heal ourselves, we heal Mother Earth." So part of what I learned from the literature and from the knowledge bearers was this aspect of how when we help a child be healthy and well, that it helps promote the well-being of the collective. So that ripple effect, like we're all connected, we're all interconnected. When each of you do your healing work, when I do my healing work, when we heal these relational wounds, that it has that ripple effect and it unites us in a powerful way, and it can lead to even more well-being and health out there. So that's really like my hope, is that we find ways to how do we have this framework sort of be embedded in our interventions, in the way that we relate with one another, and how do we build upon it, better understand it. How can we change our systems to be operating off of a framework that is relationship based like this? So those are some of the questions that I'm asking. I'm also looking at, well, how, if the child welfare system operated off of a framework like this, what would it look like? What would change? And I have some ideas on that. I'm working on a paper actually, where I believe that an Indigenous Connectedness Framework in the child welfare system would mean no more power imbalances between states and tribes and community and family. I believe that the concept of safety would be expanded, because for a child or youth to feel safe, they need those connections and those relationships to the land, to who they are, where they come from, to their family, to their community. And so that kind of problematizes stranger foster care child removals. If a child is disconnected from everyone and everything that they know and love, is that really safe for them? And that's where we got to come up with a better intervention than child removal. And I also think about how all of these different child welfare like partners and kind of the team members. I think that what the knowledge bearers shed light on was the importance of this being a shared responsibility, that all of us are working together to promote the child's well-being. So it's not about putting the child in the middle, like in the way they might in a divorce case, or like making the child feel like important relationships if they form that relationship with a foster parent and then move back to their parents or a family member. that person also disappears from their life. It's like, we got to work together and help this child feel safe and secure by maintaining those relationships. So there's a lot to be said, but I think that this framework is really, there's traction building for it, because there's momentum building for it, because we're all in this place right now, especially with COVID and addressing racism, and we're looking at systems change and policy change and a whole lot of change that it could apply to multiple organizations and systems and communities, because we're all relational beings. And that's where I feel like if you're helping to promote my child's well-being, it's that reciprocal process of it's also going to promote your well-being, because this healthy child is going to help us have a healthy community. So I just, like I said, I see everything in that kind of context now. And I think it's important to remember and sort of recognize that colonization has harmed us all in terms of who you are, where you come from. It's not meant to be that there's people on this social stratification hierarchy, like there are some people that are better than and less than others. That is harmful. We've all faced trauma. We've all faced pain and challenges. And I think we're all kind of looking out there for, well, what can help me do that healing work? So some of these mechanisms might give some ideas for you if you're not from an Indigenous background. But it's important to do that research on your own family's history and know that you also come from a land and from a place. Your ancestors were Indigenous to somewhere. So I sort of think of it that way, in a really broad macro level perspective. So it's important, to remember that healing is possible. Synchronicities happen. It's a beautiful thing. We need to discontinue in anything that is causing the relational wounding. We need to find ways to discontinue that so that we do have the time and energy to recover and to heal. And to me, the answer is connectedness. So with that, I'll go ahead and stop sharing and would love to engage in some conversation and hear your thoughts and ideas, comments, feedback, and questions, because that's one of the things that I love about presenting on this is that dialogue that we have. It gives so much back to me too, to hear what your thoughts and ideas are as well. We're co-conspirators.
Thank you so much, Dr. Ullrich, for coming today and speaking with us. I just, I think after this, I will also be seeing connectedness everywhere, even more than I already did. And, I think what you said is right. A healthy Indigenous child becomes a healthy Indigenous adult, and healthy Indigenous adults create healthy communities and healthy state and healthy future. So, this is definitely not an Indigenous people's issue. It's not just Indigenous people's knowledge. It's so interrelated. Everything is interrelated. So thank you for speaking on that. And I think, our attendees today will be very grateful to hear that, Dr. Ullrich has been speaking at a lot of different places, including, public health conferences, and I really can't even go over the list of how many times she has talked about this framework to different people. So, we are not the only ones hearing about this information. We are not, it's not limited to people who are attending this webinar. It's very much being taken up by many people who work in fields that this really matters. And so with that, we can get into questions and talking. We did make this a Zoom webinar just because I know a lot of people don't really want to have their video on and their audio on the whole time. A lot of us are working at home and have kids and stuff, and we don't want them in the background. Not saying we don't want to see your kids, but I have things going on in the background. I wouldn't want people saying. But that doesn't mean you can't speak. If you have a question, you can put it in the chat and I'll read it myself. Or if you want to say it yourself, you can raise your hand. There's a little yellow button at the bottom. If you click on that, I'll be scrolling through our participants list and I can unmute you so that you can have the opportunity to ask your question. Or you can put it in the chat and say, Malia, unmute me, and I will do that. All right. For now, I'll just start reading off the questions that we've gotten during this presentation. And if anybody wants to send anything else in or to be unmuted, just let us know. So one of the first questions we got, and I think this was in reference to, how you coded the qualitative data in the interviews that you did. One person asked that, they weren't really sure what the main code means. And they wanted you to talk a little bit about that.
Yeah, so in regards to coding, so it's quite the process. It sort of involved like I had this sort of hypothesis that connectedness, this Indigenous Connectedness Framework would show up in the stories that I was hearing from people about what they believed supported child well-being. And so in many ways, those concepts were present, but there was also new information coming in that I hadn't anticipated. And so I had like a total of 22 codes at first, which is too much. It's kind of like people aren't going to be able to fully grasp like 22 different concepts all at once. So what I attempted to do after that was to sort of merge them together to develop these main codes, these merged codes that could help us sort of better comprehend and understand some of those key concepts of child well-being a little bit better, key relationships or and as I learned about mechanisms of well-being, I also learned about like what didn't support well-being, the trauma, those challenges. It was sort of like, it's hard to explain what well-being is if this has been the frame of reference. This trauma has been the frame of reference for so long. So yeah, that's where I had a little bit of challenge with that, but it got incorporated into the framework, and that's where the resilience piece is. And I am sort of remembering to say this piece about resilience, that my hope is that we don't have to have resilient children forever. I'd love it if they could just be themselves and not have to deal with all of those traumas and challenges, especially things like racism and patriarchy and capitalism and all these sort of oppressive forces. I would love it if they didn't have to be resilient to that. So we got our work cut out for us, but we're not there yet.
We had Tia Holly also ask, earlier you were talking about how it was kind of surprising that, spiritual connectedness and intergenerational connectedness were coded less frequently than, you kind of expected. And I think that's what this is in reference to anyway. Tia, go ahead and let me know if I'm wrong. But she was asking if the frequency of that could be a result of the disconnection of, tradition in this time span, that it varies, in terms of how long people have been disconnected. Some people have been disconnected for only 50 years, whereas when places where contact was earlier or things like that, it's longer.
Yeah, and that's part of when I got feedback from someone at FFCA. They were sort of thinking about how child removal can lead to more of that disconnect from their family history, from connecting to their ancestral lands, especially if they had to move out of their home community for placement purposes, which happens all too frequently in our state. And then the aspect of the spiritual connectedness, if children aren't placed with people that have that knowledge, the cultural knowledge, that can lead to more of that. So again, that wasn't like what I was totally trying to focus on, but that's something that I'm curious about and would love to study a little bit more.
Yeah. And then, we have a lot of questions on the topic of where this framework is going and how people can interact with it, how people can use it. And Santa Claus, Councilman Santa Claus from North Pole has suggested sharing with, Interior Secretary Holland, Medical Officer Zink, APOCS, a whole list. I can share that with you. And then we also have some people asking how they can connect with this work or get in touch with you or learn how to, like we talked about, this is malleable and it shouldn't be left like as is. It should be changed to work in your community. And so how they can learn more about that as well.
Yeah, so I have spoken with numerous people, including Lisa Murkowski's office. And I've presented at a multitude of different conferences. And that's where I feel like there are many Indigenous scholars that are doing this similar kind of work, where we maybe are focused more on the environmental aspect, or we're focused more on the family aspect, or, like there's so many different ways that this work is already kind of happening and being done. And including in your communities, if you have culture camps, or like you're working on developing prevention programs or interventions that are going to get at the root of any sort of healing process, like healing from trauma, helping people recover from substance use, or how to prevent youth from being homeless. It can apply in so many ways. So that's what I keep telling everyone, even when I spoke about this applying to missing and murdered Native Americans. It's this healing work. Again, I feel like understanding the relational wound, that there's a perpetrator and a victim in that, and how to help the perpetrators heal, and how to help the victims heal, so that we're back in right relationship with ourselves, so we don't continue to harm, and we aren't continuing to allow people to harm us. Like that's part of this relational healing aspect, the connectedness aspect, and knowing that we have the answers and the solutions, we have those mechanisms, and to give that more credit than what some of the Western mainstream funding sources that want to give credit to. I know we're shifting that, we're changing it. I think doing research along these lines helps with that. But we definitely need more work, and we need all hands on deck, and we all, I think, can think about and be creative about, like, how can we pick up a framework like this and apply it to our specific community context. What do our elders think about this? How else could it be explained or visualized, captured in terms of teaching this to children and incorporating it in schools and those sorts of things. So it's it's huge. And I sometimes get a little bit overwhelmed at how huge it is, but it's also important to remember it's simple at the same time. Keep it simple as well, that we don't have to wait for millions of dollars in grant money to do this work. We don't have to wait to do our own healing work. We don't, especially if we have those avenues and mechanisms, relationships that can help us do that healing, because listening to and telling a story, that alone is a healing ceremonial process. So yeah, it's I just pray, I'm continuing to pray that this info continues to get picked up and used in whatever way you might find most useful. And I'm happy to, I'll provide my contact info in the chat. And if I can help you think about some of the application pieces a little bit more, I'm more than happy to consult with you on that.
Mm-hmm. Yeah. And I can send your contact info out if you'd like as well.
Yeah,
Everybody will be getting a follow-up email from me with lots of information.
Yeah.
I think we only have time for one more question. So for non-Indigenous people who are wanting to advocate for the use of this framework and advocate for this sort of relational healing and this connected healing, what is the right way to do that? And how can someone learn, how to do that without kind of, taking over Indigenous voices or, you know.
Yes, so really good question. And I think part of what I've learned to shift, the shift that I've made is to focus on the strengths. So again, like no matter who you're working with, and if you focus on the well-being and what's already strong and what's well within the community, and you build upon that's where I think you're going to have people more excited to join your efforts. Because when we come from a place of love, we feel that it's in love, and that energy shift is like, it's our renewable resource. It has an unlimited supply of energy for us. If we come from fear and anger and trauma, that wears us down. It burns us out. It sucks out our energy and our life force. So if you're trying to focus on the trauma, that's important to acknowledge trauma, and I feel like what I learned is, even if you're focusing on well-being, the trauma is going to come up. It's in a good way though. I don't know, because it's more balanced with the strength and well-being aspects, the resilience elements. So that engagement and getting people involved and excited about this, focusing on child well-being, is, I think, it's going to have better outcomes in terms of inclusion and engagement. But yeah, there's more to be said on that, but I know we're out of time, so.
Yes, Ganesh, and I realize we have, some people that we weren't able to get to, some questions we weren't able to get to, and, this is not because that, they were not good questions. There was very, very many good questions, lots of voices and comments, and I will make sure that all of this is passed along to Dr. Ullrich so she can have time to process it and, do what she may. We just, there's only so much time in the day. But yes, everyone, thank you very much, Dr. Ullrich. Everyone, you will be getting an email with lots of follow-up information, and you can feel free to send this recording and these slides to whoever you may want to. People can also register actually after the date, so people can continue to register for the webinar and they can keep having access. And Dr. Ullrich, if you have any final comments, go for it.
I just want to end with one final comment, and that was my youngest daughter at my dissertation defense brought up a really good question and point. And she said, Mom, aren't all grown-ups children? And I was like, yeah. And she said, because you all have mom and dads. I was like, oh my gosh, mind blown. Oh my gosh, this is about all of us. So that's my hope, is that all of you, you continue on your journeys towards wellness, so that we all can be all the more healthy and well. So thank you all for your time and attention today, and I look forward to staying connected.
All right. Sheesh, everyone. Enjoy the rest of your day.